So I'm going to speak today about the health benefits of sport, and very much in the context of the sports strategy. And it's fantastic, the two great presentations we've had already, which link very, very closely to what I'm going to be discussing. So in terms of health challenge, the public health challenge that we face in this country, we talk about waves of public health, and we're in a new wave of public health. So the first wave was about clean water, then we had antibiotics, but now the real challenge is non-communicable disease. And this picture shows you a few of the key points about it. But one of the key things is understanding that if we look at premature death, early death, we know that only 10% of that can be prevented by healthcare. 40% of that can be prevented by helping people to change their behaviours. And that's £30 billion that could be saved if we manage to change people's behaviours. And at the bottom it shows the three key behaviours that this country performs a lot worse in than other countries. So that's smoking, alcohol consumption, and in particular physical activity, which I'll talk about in a moment. But we also know that only 4% of the health budget goes on prevention, despite the fact that 40% of the gains in terms of preventing people's early death could be from changing behaviour. So we need to work in trying to change that. And the NHS 5-year forward view, which came out last year, for the first time prioritised prevention in the NHS. So it's a fantastic opportunity for us. So in terms of what we know about what actually causes the health burden in this country, both in terms of the morbidity or mortality from disease, Public Health England was published in October last year an analysis for England of the global burden of disease data. And this shows the key factors that are the risk factors for people developing disease in this country. And if you look in terms of the top 10, physical activity is in there. So as well as diet and tobacco, one of the key factors is physical activity in terms of the top 10. So it's a great opportunity for us to bring together the physical activity in the sports sector and the health sector to start to make some real changes in terms of the health and well-being of the population. So just to summarise, in terms of literally physical inactivity is killing us. So we look across the population, and since the 1960s, cultural, social and economic changes such as increased car usage, increased home-based entertainment has actually just made us become less active. So we're 20% less active than we were in the 1960s, and by 2030, unless things change, we'll be a third less active. And this has consequences for our population in terms of their health and well-being. So 1 in 6 UK deaths can be directly linked to being insufficiently physically active. That's the same as smoking. And we know that up to 40% of many long-term conditions, such as type 2 diabetes, could be prevented if people were sufficiently physically active. And so we know that 7.4 billion cost, and that's probably a gross underestimate, there's a 7.4 billion cost to the country, including 1 billion to the NHS and over 6 billion to the wider economy of people being insufficiently physically active. So we know that the WHO, the World Health Organization, and the UK Chief Medical Officers have highlighted many times that over 20 conditions could be prevented or managed by people being sufficiently physically active. And so I mentioned diabetes, coronary heart disease, a number of cancers, and also even a third of physical limitations. So what people describe as ageing, i.e. people being less independent and less physically capable, a third of that could be prevented if people were supported to be physically active. So it's important that we consider the importance of and the role of physical activity across people's lives. And so this graph shows that though the benefits are not universally shared by getting people physically active. So this is a graph of physical activity along the bottom against the risk of ill health. So that could be diabetes, that could be cancers, any of those conditions that I showed earlier. And you can see that it's actually a slope. It's not a line. So actually we have the greatest benefit in terms of improving people's health from the people who are inactive. And actually, we don't even, although we talk about people need to be doing 2.5 hours, 150 minutes per week of physical activity, actually the greatest benefit is just from getting people to do nothing to something. And so in particular we talk about people who are inactive, and that's people described as doing less than 30 minutes per week of physical activity. And so that's less than the time people watch an episode of EastEnders for. So we need to focus in particular on those people and just to try and get them more active. Let's not worry too much about getting to 150 minutes. Any increased amount of physical activity will generate a health benefit. And if we compare to other countries, you'll see it's difficult because we measure physical activity slightly differently across different countries, but there's a number of international studies that have done it, and they've used the same measurement and then compared different countries, and you'll find that, shockingly, the UK is amongst the worst. So we're twice as inactive as Germany and France, and what surprises people is we're 50% more inactive than in the States. So in terms of how it affects our population, it's not universal, and you can see inequalities across all of the protected characteristics plus socioeconomics. So we know that people who are disabled are half as likely to be participating in sport as the general population, and we can also see inequalities across gender and across age. So we know that there's certain spikes where people are less likely to be physically active and drop out of physical activity. In childhood, it's amongst people when they start school, 5 to 7, and also once they start going into teenage years, particularly for girls, and also once people get older. So we can see a huge drop-off once people achieve 65. And so we need to recognise that, but we also need to recognise that it's an issue across our population. The fact that a fifth of men and almost a quarter of women are doing less than 30 minutes of physical activity a week is a huge issue. So that's why we published Everybody Active Every Day about 18 months ago. So that's the National Physical Activity Framework. So we developed that based on consultation and co-production with over 1,000 people across the country, including a number of people I know here. And also it's based on the international evidence about what works. So what we know works is we need cross-sector partnership. No one sector can do it alone. We need long-term commitment. These things take years, decades, rather than 1 or 2 years. You can't do it in a 3-year business plan. And also, we need to focus on those who are inactive. So as well as trying to get people to health-promoting levels of physical activity, what we call 150 minutes, we need to focus in particular on those who are inactive. And so the evidence shows that we need action at local and national level across 4 domains. So the first one's about active society. It's about changing the social norm. So being physically active is the expectation and the desire of people. And so that's about changing behaviours and changing expectations. And so that's why, say, for example, the Change for Life campaign is working with children, focusing on children and families. And a number of you will know that on Monday we also launched the 1U campaign, which focuses on 40 to 60-year-olds. And moving more is one of the 7 behaviours that focuses on. And then about moving professionals. So we already have a range of professionals and volunteers who work every day with individuals and are the best people who are able to help people understand the benefits of physical activity and understand how they can incorporate that into their daily lives. And so within the framework, we identified 4 key sectors that have a potential role, and in particular, sports and leisures. So that's about upskilling volunteers and professionals so that they can embed physical activity into what we talk about and make an every contact count approach. So basically every engagement opportunity we have with a member of the public, we help them understand about and think about physical activity. So the first 2 domains are really about generating demand for physical activity, making people want to be physically active. And then we need to also think about creating supply to provide those opportunities for people to be physically active. So the first one's about active environments, and that's about creating the physical spaces that support people to be physically active. We know that environment shapes behaviour, and so we need to think about how our environment can encourage people to be physically active and support them to be, rather than the opposite. And in particular, that's about thinking about inequalities and embedding that. So creating age-friendly environments and disability-friendly environments. And then the last domain is about moving at scale. So we need to identify what works and scale it up. So that's about actually measuring, evaluating what we're doing. So making sure that positive change happens at every level, is measurable, permanent and consistent. And that's about recognising that actually we won't have more funding. If anything, we know, as we've discussed earlier, there'll only be less funding going forward. So we have to maximise what we've got. This country has a fantastic history and wealth of assets in it, which a lot of other countries are very jealous of. So we have to understand what those are, both human and physical, and actually maximise those. And so in terms of the sports strategy, so from a public health perspective, it's fantastic. I won't repeat what Judith said, but it's very much, in tune with a public health approach. So in particular, the focus on looking across the life course, so from 5 years onwards, and also looking at inequalities groups and those who are currently inactive or not participating in physical activity in sport. And also in terms of the definition, recognising that actually, a lot's changed in the decade or so since the last sports strategy, and people look for variety. People won't just be a cricket person or a sports person or a tennis person. People want variety, and we need to recognise that and provide that if we want to engage people. And lastly, about focusing on outcomes. So, previously it's been bums on seats, if you like, but increasingly it's fantastic that we're focusing actually what makes a difference to people's lives and focusing on the potential for physical activity and sport to do that and do that consistently. And so in terms of priorities for the sports sector, there's a lot of fantastic work out there, but actually we need to prove it and we need to replicate that. So it's about embedding an evaluation within what we do, but that evaluation should be appropriate to what we're doing. So a small project doesn't necessarily have to have the same level of evaluation as a large-scale innovative project, but actually we need to measure everything that we do, have some level of evaluation, and also identify what is working and then share it with people. So we don't always need to have our own pet projects. We need to identify what works, share it, and scale it up. And then it's also working with the local system and the local population in terms of developing the offer. We need, and it was, I think Judith discussed earlier about, insight. We need to use insight so we shape offerings that the local population want and actually link to the local assets that we have. And so we can only do that by engaging people in the development and the evaluation of services. And finally, as I say, scaling up what we know works. And so in terms of, the potential of sport, obviously, Nelson Mandela, he does a lot of things a lot better than me, but one thing is in terms of, encapsulating actually the true value of sport. And I think this is starting to be recognised, in particular by some public health teams across the country. It can do things that the statutory services cannot. So it can inspire people, it can unite people. It can speak to youth in a way that the NHS can't, and it can actually create hope for people. And so we need to harness that and recognise that and utilise that. And so that's why I say, a number of services across the health sector are recognising that actually partnering with sport is a much better way to do a lot of stuff, even stop smoking, the alcohol, sexual health services. A lot of that is starting to partner with the sports sector because they're the ones who can speak to the population best. And so whilst I've spoken about physical activity, it's a great opportunity to think about there's a lot of public health challenges that sport can uniquely contribute to. And this is a chance to actually speak to colleagues within your local area about, the offer, the added value that sport and physical activity can give. So substance misuse, mental health, workplace health, domestic violence, the list goes on. Almost all public health challenges, sport and physical activity have a great opportunity to contribute to. So just to finish up, since looking back, since the publication of Everyday Active Every Day, this fantastic progress has been made. But we need to increase the pace and scale. As I talked about, there's decades of decline in physical activity in sport, and so we need to address that, and we need to address it quickly if we're to address the social and health challenges of the population. And we need to link into local changes. So you can't fight it, and it's happening, so we need to link into it, and the system reform that Simon was talking about. So in particular, recognising that there's huge changes in terms of integration, co-location and delivery of scale of local services. And sport and physical activity is a great opportunity to link into that. And also recognising what's happening at a national level and national opportunities. The sports strategy we're discussing about, the childhood obesity strategy and the cycling walk and investment strategy which will be coming out in the summer, and obviously devolution. And we're standing in Manchester, and I know the sport and physical activity sector is engaged and doing a great job in terms of engaging into the devolution which Manchester is leading the way on. And so we need to work with those changes and actually utilise them to make a step change in sport and physical activity. Thank you very much.